I'm going to be focusing more on, not on the methodologies of evaluation and all that, but what can institutions learn or reuse evaluation results to influence their future programming as well as policies within the institution. So I'm just going to use World Vision as an example of how we've used evaluation results, which have influenced how we are currently doing our programming, especially in the area of agriculture, nutrition, and health. World Vision is a global organization with operation in almost 100 countries, and we work in more federated network sort of way, and our work goes from advocacy as well as relief and also development. And I'm just going to focus mostly on the development aspect of it and also the advocacy piece. Agriculture as well as health has been one of the cornerstones of World Vision programming for the last almost 40 years. Nutrition has been kind of the missing link. And what has happened normally is there has been an assumption that nutrition is being taken care of in agriculture or in health. Over the course of time, a major evaluation was done for World Vision programming across the globe around 2003, 2005. And that link was actually clearly identified that there was actually a clear missing link there. And it was also found that as a child-focused organization, one of the main outcomes for our programming should be improving child well-being. Child nutrition was one of the major issues. But looking at the results from the agriculture and health interventions, it was clearly evident that this sector-based programming was not reaching that goal. So though we were doing very good agriculture work, we were doing a lot of good health work, there was still that aspect that malnutrition rates were not significantly changing in those areas. We were improving food security for the communities. There was improvement in health in many situations, but there was still insignificant changes in the nutrition. And this link was, why was it happening? And that evaluation kind of kept coming up in most of the projects we were doing across the globe. At the same time, we were also undertaking some grant-funded projects in a couple of countries. One was in 6 countries in Africa, and it was intentionally focusing on nutrition, but it was an integrated program with agriculture as well as health component. But there was an intentionality of bringing agriculture for a nutrition-based outcome. And these programs clearly showed an improvement compared to our overall programming. And the question was, why was one showing this and the other? And that's where the missing link actually, or the sectoral divide, whereby nutrition was not intentionally being programmed as a program per se. And even to today, we still don't intentionally program nutrition in most of the areas. But the reality was, when the designs for agriculture programs was being done, nutrition was not considered as one of the outcomes. Likewise, in health, there wasn't a very clear link on how nutrition would be impacted at the end of it. And these two evaluations, the evaluations for our normal programming as well as for this grant-funded program, kind of brought out some key lessons for the organizations, which have been used to influence how we are programming. At the moment, nutrition is one of the global outcomes for World Vision programming across the globe. All our programming focusing on children have to show an improvement in nutrition as one of the major outcomes. And this kind of came out from all these evaluations that were being done across our programming, showing that there was actually a missing link with our programming in agriculture and health. Some of the key lessons that we got from here, I'll mention a few. There are many lessons, but some of the key lessons that we got from these evaluations, some were opportunistic, but others were well in line with what we were doing. And sometimes things happen and you have to take advantage of them, but if you're not prepared, you actually cannot make the change. One of the things that came up was the translation of these nutrition evaluation results for specific and effective decision-making was very instrumental for us to make this change. The assumption is always that people will understand what the results of an evaluation are, but the reality is not the case. You find senior people in the organization may not have a very clear understanding of you tell them, in this program we had malnutrition rates of 35 or 40%. It doesn't make sense. You have to translate that into a language or into figures that they can understand. And that kind of was how we were able to actually make that institutional change, because there was a core team of people who are working with this information to try and influence the senior leadership by showing what was at stake. that this is a reality. We are investing this amount of money into these communities, into these programs, but you're not getting the results we're expecting. So there was kind of a disconnect between our investment and what we expected to come out of. So the translation of that information at the institutional level was effective in making those changes. Vice versa, the same thing, translating evaluation results for the programming people in the field. Again, there's an assumption that programming people in the field will understand the same thing. They don't. In most cases, you'll find nutritionists, we don't have that many nutritionists in our programs. And so when you give an evaluation results that shows malnutrition is this rate and this rate, people don't really understand what exactly does that mean for my program. What is the reality of what I'm doing on the ground? So in most of our programs, you find agriculture-based people are mostly the managers. And so you come in with very clear indication of nutrition. There's a problem of malnutrition in this community. Well, how does that person understand what exactly does that mean? I'm actually from an agriculture background, but I've worked with nutritionists a lot, so I can make some sense of all that information, but I can't say I'm an expert in nutrition. And so one of the lessons that also was, how do we translate the information from evaluations of nutrition program for people who do not have a nutrition background, who are implementing programs that are supposed to actually have an effect on nutrition? Because programming decisions the future programming decisions in areas that have shown they have high malnutrition rates need to actually take nutrition, intentionally target nutrition as one of the outcomes for agriculture, which in most cases was not happening. So that's one of the things. But at the national level also, the same thing, translating information, evaluation results for national policy decision makers so that they are able to make decisions that will actually translate this nutrition or programming interventions to improve nutrition in their countries. And that's kind of the divide we find. Results come out, good evaluations are done, but the translation of that information into ways that people who need to make decisions, either programming or policy decision or institutional decisions, do not actually understand that. So that translation is one of the key links that we found was missing. The other aspect is the invisibility of malnutrition. If you go to communities where there are most development workers, and I've done that myself personally, actually here in India, I remember visiting one of the programs you have here in India, in Bihar, and as we were discussing, I asked one of the staff we had there, what's the malnutrition rate in this area? And he said, okay, 42%. What does that mean for you? He had no clue. He had no clue. He knew the numbers, but he had no clue what it really meant. He couldn't translate that into any programming decision because it didn't make any sense to him. And that's the problem, because malnutrition is actually invisible in most communities. You ask people, why are children here short? They're always short. All our people here are short. So, but if you come in with the evaluation result, it shows that stunting is a problem here. But if everybody is short, and from if development workers themselves are saying people are short in this community, that's how it is. It becomes a challenge. How can you actually make changes? And so that's one of the things. The invisibility of malnutrition requires that we actually take efforts at trying to increase investment in training people who have a nutrition background, or even trying to cross-train people in agriculture to understand what are the implications for high malnutrition rates in their programming areas. The other thing I would want to talk about is sustainability of agriculture program interventions and the nutrition benefits which accrue from that. From most of the programs, actually, you'll find as long as the program is funded well and going on well, the interventions are going on. Once the funding ceases, either the interventions go down or the nutrition benefits that were accruing from that agricultural interventions actually start declining. And how do we sustain that? One of the things is actually education, educating communities as well as educating the program staff in ensuring that there's a sustainability, not only of the interventions that are making positive changes in nutrition, that's agriculture interventions, mostly food-based interventions, but also for those nutrition outcomes that are arising out of that. So how do you sustain that? That's mostly through education, both for the staff as well as for the communities. The other piece that also a key lesson that came out of this was integrated approaches will need strong coordination as well as shared funding and monitoring between them. This is one challenge because as much as we talk a lot here, and there are many donors talking about here, most donors still they still fund sector-based programming. I'm having that challenge myself at the moment. We are trying to write a program on food security, but we want to have a nutrition outcome, and we are having a challenge trying to meet the donor requirements for that, because the donor wants you to have a specific outcome on increased productivity, not nutrition. Say nutrition is a different area. So that's the challenge also. You find that though you may have good ideas, sometimes you also, if the donor is calling the shots, you have to focus your interventions in a way that may not actually meet what you really want to achieve. And so that's one of the major challenges you also find. And one of the major lessons we got, that the integrated approaches will need a very coordinated, but also shared funding between the sectors as well. The other thing I just want to bring was the issue of making nutrition as a clear outcome in agriculture programs. That's something that is still, in many programs, not very clear. People still resist making nutrition an outcome in agriculture programs. It doesn't have to be in all, but we need to have nutrition-sensitive indicators in that agriculture program to be able to actually address malnutrition issues. The other piece that comes with that is there's actually kind of a disconnect sometimes between the assumption that increased productivity will actually lead to improved nutrition. That doesn't always happen. There's really no direct causal effect. There must be interventions in between that will actually address the malnutrition. But the challenge also is that the lack of practical agriculture nutrition indicators that can actually show that. So that's always a challenge, because the current indicators are either very nutrition-based or very agriculture-based, and trying to find indicators that can cross that. There are few, but they are not very well utilized by most programs. So that's the other challenge that we find in trying to influence programming using evaluation results. And so these key lessons actually provide a way for us as an institution to be able to make some changes in our programming to ensure that we are sharing funding between sectors rather than having sectoral just funding. There's more integrated funding to support our programming, agriculture, health, and nutrition. But overall, also trying to ensure that we are communicating this information both to the programmers but also to the decision makers to ensure that good decisions are made to ensure that nutrition is catered for in all these programs. Thank you.